in
That's
the
amazing.
collective, we move every 3 months, we're cycling through this framework of naming vicarious trauma, taming vicarious trauma, and reframing vicarious trauma. And so that means that each month we get to cycle through one of those. And so we always know we're kind of coming back to naming at some point, that we're regularly touching on how do we manage vicarious trauma and taming. And then also reframing is super important. And it helps us to also look at the other side of our work in terms of vicarious resilience.
Hi, I'm Kim Tolson and I'm the traveling therapist. It's my passion to teach therapists how to navigate online private practices and multiple income streams so they can travel the world. I'm a digital nomad with a virtual insurance-based private therapy practice and a multi-six-figure coaching business. I'm obsessed with entrepreneurship and developing tools that can help therapists live an adventurous lifestyle. In this podcast, I will discuss my journey as a digital nomad. I'll chat with other traveling therapists and help you navigate the complexities of running an online insurance-based practice. I'm so glad to have you with me on this journey.
Welcome back, everybody, to another episode of the Traveling Therapist Podcast. I'm really excited today to have Jenny Hughes here with me. I'm just learning about Jenny, so I'm super excited to introduce her to you guys and what she teaches other therapists to work on and live with. And we actually met the other day for a coffee chat, and I was just so energized by the conversation. I could not wait to get her on this podcast for you guys to learn about what she offers. So Jenny, can I turn it over to you and have you just talk a little bit about what you do for therapists and how you help therapists, and then how we're going to talk about that today around this traveling topic?
Absolutely. And thanks for having me, Kim. I'm so excited to be back too. I loved our coffee chat the other day, and I've been really looking forward to this. So I'm a psychologist by training, and I do like 99% trauma work. I'm a trauma therapist. And that's my love, my passion clinically, and is something that is really fulfilling for me. But I also know how heavy that work is. And so another thing that I do in addition to my clinical work is I help to support fellow trauma therapists with vicarious trauma.
Yes. Oh my gosh, such an important topic.
Yeah.
And we were actually talking about this the other day, the vicarious trauma piece. A lot of us, I think, don't even pay attention to it. We just like push through and keep going and keep going. We don't even realize we're traumatized. And I also am a trauma therapist. I am EMDR trained. That was my specialty for a very long time, post-traumatic stress disorder, using EMDR, and it's some heavy stuff. And I think you just like over time, just get like immune to how heavy it is, I guess, desensitized to it, I guess you would say. I don't know, but
yes.
What do you think?
And
Tell us about it.
Yeah.
She's like,
certainly there is that element of we are specialists, and we have grown and like really worked on our capacity to do this work. But there are also so many messages out there that we're just not supposed to be affected by it, that we're just supposed to suck it up and deal with it. And that if we are affected by it, there's something wrong with us. Actually, inside of the Brave Trauma Therapist Collective, where I do my work around this, just last week in our call, we were talking about this. And one of the trauma therapists had brought up a difficult case situation, and we were really supporting her to kind of walk through and talk through what to do. And she shared with us how helpful it was, because she was like, in all my training, I was told that if I had a reaction to a client, that it was something wrong with me, that I needed to do some work. And like what happened to her was objectively frustrating. And we were like, you're allowed to be mad. It's okay. You don't need to go to therapy because you're mad about this situation. And like, I love going to therapy. I'm not saying that we should certainly do our own work, but there's so many mixed and unhealthy messages out there that we receive as therapists that we just have to be perfect. And that makes it really, really hard to be able to acknowledge the vicarious trauma that we inevitably experience.
Absolutely. Oh my gosh. Yeah. So, okay. So when we were talking the other day, we were like, how does this tie into traveling, right? Because traveling, right, is the message is sort of like, oh, it rejuvenates you. It's like, it's good self-care. Do this, especially if you're feeling burned out, especially if you're dealing with even vicarious trauma, go do that, take care of yourself. So how do you think that ties into this big picture that we're talking about now?
I think it's both and. I think, yes,
Yes.
being able to have the flexibility and the new experiences as a traveling therapist is really energizing and healing and exciting, but also it can feel destabilizing at times because everything is new and you're always having to shift and adjust. And one thing that can be tricky when you're a traveling therapist is kind of knowing who's your community, who are your go-to
Mm,
people that remain
mhm.
constant no matter where you are in literally the whole world, because you can be anywhere.
Absolutely. Yes, it's so important. Oh my gosh. So, yeah, me as a digital nomad, right? I move basically every 2 weeks, every month, we move to a new place. So, Jenny and I were actually talking about this that yes, it's great, but it's also dysregulating. I mean, to get to a new environment and then on top of it, some of you guys probably remember I have celiac disease. So I have to like have a safe kitchen everywhere I go. So every time I move, it's very dysregulating, and if I've got vicarious trauma on top of it, and I'm not really working on my stuff very well, it can be super tough to do that like over and over and over again. So what do you think about all that, Jenny? I know we talked about it some already, but what's your take on that, the dysregulation and how it affects us and how maybe we can cope with that a little bit better if we are doing the traveling thing or even like a full-time digital nomad. What do you
Mhm.
think?
So, one of the first and most important things for any kind of therapist, but I think especially for someone who is a digital nomad, is honestly doing a bit of tracking, just like we
Uh-huh.
ask our clients to do a lot, just so that we can understand two things. One, what's kind of our baseline, and
Mm,
and our baseline of like healthy ideal functioning, not perfect, but like where do I ideally want to be, for the most part, to know that I'm functioning and regulating well enough to be a human and to be a therapist.
mhm,
And then the other piece of it is actually tracking vicarious trauma, which
mm,
it can feel really scary, going back to those messages that we were talking about earlier that we internalize, that we're not allowed to be affected by our work, but is actually, it's one, valuable data. As a psychologist, I think I was trained to like think about data a lot, but it also can be like so validating and ultimately
mhm,
empowering.
mhm.
And so
Absolutely.
something that I work with people a lot on is helping them understand, how does vicarious trauma show up for you emotionally,
Yeah.
physically, relationally, and occupationally, and
Wow.
tracking on a regular basis. Actually, inside my program, we track every 3 months, because
Wow.
it is so important to track it regularly. VT will just sneak up on you. It's a chameleon and it
Yes.
will wear different masks. And all of a sudden it's like, oh my gosh, I just got blindsided. Like, what the hell just happened?
Yes. Well, what can we talk about that a little bit? Like what, especially for a therapist that's just listening to this and they're like, wait a second, I don't have to be perfect. What is vicarious trauma? I don't even really know. Like what what should somebody be looking for to get some awareness? I hear you saying it's around all these different areas in your life, but what could we tell somebody to help them even start an awareness about that or even how to track that stuff,
Yep. Yeah, so let's go through kind of the 4 different categories.
Okay.
So, vicarious trauma, so emotional stuff. So often it'll show up as, like, for me in particular, being real irritable.
I'm just going to start raising my hand as we
All
talk.
right. Or like feeling more anxious than usual, feeling like
Okay.
you're really worried about like yourself or others. That kind of overlaps
Mhm.
with relational, but it
Yeah.
can also be like feeling kind of like withdrawn and down and depressed.
Mm,
And quick caveat, vicarious trauma is not a DSM-5 diagnosis, nor should it ever be, because it's not something pathological. It's just a normal experience. It is our own
yeah.
natural physiological reaction to doing difficult stuff.
Mhm.
And when we're not taking care of it, these are the things that can start to show up.
Yeah.
So it's being aware, like, are you more irritable, more anxious, more down and depressed than usual, right?
Yeah. Right.
In terms of physical stuff, it can show up in physical aches and pains. We certainly need to tease that out when we have other medical stuff that's going on,
Just
but it
thinking
could
that.
be like, taking more like sick or mental health days than usual because you're realizing just how drained you are. It can
Mhm.
be stomach aches, headaches, just like body stuff is coming up.
Yeah. Mhm.
Relationally, another big one for me is isolating. And that comes back to these internalized beliefs of like, well, I have to take care of myself. No one's allowed to take care of me. I can't ask for help, as I roll my
Mhm.
eyes at
Yeah.
myself.
Right. It's like how many times has a client said that to you and you're like,
I
now come
know.
on.
I know. But we
Yeah.
often, when we're struggling with vicarious trauma, will isolate. And it can feel hard to connect with people that we care about and that we love. And another relational thing that can show up with vicarious trauma is sometimes it can be hard to relate to people outside of our work,
Mhm.
particularly as trauma therapists. When we are not wringing out our vicarious trauma sponge, and I
Yeah.
use that metaphor because it's just the soaking up of the stress and trauma that we're exposed to every day.
Yeah.
It can feel really hard to be empathic when your kid like scrapes their knee, right? Or
Yeah.
your partner comes home and is like, "Oh, my coworker's so annoying."
Mhm.
And so noticing some of those reactions in your personal relationships of like,
Mhm.
"Oh my God, that's so not a big deal." And being aware of how strongly you're feeling that and the kinds of emotions that are coming up for you.
Mhm. Absolutely. And I love this idea of tracking all that stuff because, before I pressed record, I was telling Jenny, oh, I got gluten this weekend. I've got this brain fog. I've got it. And when I get that, I get like this weird anxiety. It's like terrible. But then I also get PMS, like who does it? Or PMDD almost, So,
Mhm.
I like this idea of like, okay, what are your physical health problems? What is your like hormonal stuff? What is like the vicarious stuff? And how do you even differentiate between those two to know like how to take care of yourself, you know?
Yeah, and I think a big and a valuable thing that can help us differentiate is also then that fourth category of occupational like
Nice.
signals or signs, because a lot of like the physical, emotional, relational can come up with other stuff, right? Like
Mm-hmm.
related to
Mm-hmm.
our hormones, our health, other things that are going on in the world. The occupational signs are like really just like dreading work, avoiding emails, voicemails, even like not wanting to see clients that we really enjoy and that can feel
Yeah.
energizing for us. So that's a big one.
Mm.
And
Oh,
so
that's
when
good.
you notice that occupational stuff is also happening, that's a really great way to help you just kind of do that differential diagnosis thing of like, is this VT? Is this real life stuff? Like, where does it live along the spectrum too? Because it's not one or the other. It's never
Mm-hmm.
just one thing.
Right. Absolutely. So in the Brave Collective, you said every 3 months you guys kind of do like a group assessment, I guess, around all these areas to see where we are with that stuff. Yeah.
Yeah, so in
That's
the
amazing.
collective, we move every 3 months. We're cycling through this framework of naming vicarious
Nice.
trauma, taming vicarious trauma, and reframing vicarious trauma.
Yeah.
And so that means that each month we get to cycle through one of those. And so we always know we're kind of coming back to naming at some point, that we're
Nice.
regularly touching on how do we manage vicarious trauma and taming. And then also reframing is super important. And it helps us to also look at the other side of our work in terms of vicarious resilience and all of like the
Mm.
amazing benefits that we get from bearing witness to the work that our clients do.
Yes. Oh my gosh. I love that. Vicarious resilience. I don't think I've ever heard that before.
Yeah, it's
Wow.
definitely a
Okay.
lesser known term, but it's
Interesting.
so powerful. And coming back to I think the traveling stuff, I think that is a really I would be curious. I can't speak to this from my own experience, so I'm curious to
Yeah.
hear from you. So I wonder if, especially in those times when you're feeling regulated as a traveling therapist, does it feel like you are more open to and more positively affected by like the amazing stuff that your clients are doing and the progress that they're making in therapy, whether big or little?
Absolutely. Yes. I mean, the better I am, the more I'm able to like get outside of myself, I think, and just, you know, be connected to other people, I guess, in general, just all the progress that they're making. So absolutely. Yeah. Because
Yeah.
when I'm, not great, it's so easy for me to like just be so focused on this feels bad, yuck, and, ugh, and you're making me upset. And, it just this negative like spiral I get into. So absolutely, if I'm regulated and good and really liking the place we're at and my schedule's not crazy, absolutely. And not only, with my clients, but just even get the people in my membership and the therapists I'm helping every day. Like it's, I'm able to appreciate it a lot better for sure.
And what role do you think traveling has in helping to enhance that?
Just, I am a happier person when I'm
Yeah.
like fulfilling my wanderlust, I say,
Yeah,
because I'm sort
totally.
of like a gypsy in a way, like I don't feel great when I'm just like not stuck, but just like settled somewhere. Like I like to just be going to the next thing. Like I'm always like, okay, what's next? And I dream big and it's like, oh, wouldn't it be cool to be in those, heated pools in Greece that you see on the side of the mountain? Like I'm always like daydreaming about where's the next place I'm going to go. So
Yeah.
for me to have like, because we just got to a new place, but, we'll be leaving here in 3 weeks and I'm already like, oh, I can't wait for the next place, so I'm always pretty excited about like the next step for me.
Yeah.
When I don't really have a trip planned or something like that, like before I was a digital nomad, it was like, okay, I'll be traveling soon, I guess, like that kind of thing. Hey everyone, I wanted to break in here real quick and let you know about a company called Alma. As you may know, I have a variety of resources available to therapists who want to bill insurance in their private practice. I have a comprehensive membership to teach you how to bill on your own, but I also refer mental health practitioners to companies like Alma who can do your billing for you if you don't want to hire billers or do it on your own. If this sounds like the kind of support you need in your insurance-based private practice, consider joining Alma. Get the tools and support you need to manage and grow your private practice, accept insurances, and focus on what matters most, delivering high-quality care to your clients. I've shared my personal referral link in the show notes of this episode if you want to schedule an appointment and check them out.
And that's like the human, we have to be ourselves, and we're a human and a therapist at the same time, right? And so being able to integrate those things to the best of our abilities is so protective when it comes to something like vicarious trauma. And being able to like live that out, I mean, that's like the ultimate dream, right?
Yeah.
And not traveling necessarily for everyone, but like whatever that
Right.
integration is of being a human and being a therapist and getting to live that integration.
Absolutely. Absolutely. Yeah. And, we were talking about this when we met the other day, but this realization for myself, and permission given for myself, because, I always saw the most intense clients. I saw the dual diagnosis, the PTSD and the substance use disorders, and, these really heavy, intense cases, EMDR, and, all of this. I really, when I moved into coaching, the coaching scene, and the digital nomad scene, I had to make like a very conscious decision that my caseload was no longer going to be this real, heavy, chronically trauma laden sort of caseload anymore. And, I was seeing like 30 people a week at one point, so I had to purposefully like tone that down because of all this other stuff I was doing and the intensity of the caseload. So I don't know, maybe we could talk about that a little bit too, because, there's feelings about that. Like, oh, I should be doing this intense work for my whole life, So what do you think about that?
Yeah, it's that, oh, I'm not good enough if I can't do this super intense work for the duration of my career. And One, I called BS on that. I don't think that that's true because every therapist is good enough and strong enough. And one of the things that I work with folks on is how do we make informed choices about our careers? You know, one of my goals with Brave is to help therapists prevent getting to that point of burnout, because I view vicarious trauma existing on this spectrum. So we all experience vicarious trauma. I view it as inevitable, regardless of your specialty. Like you as a therapist are an empathic human, you're going to soak up stress and trauma. And all of our clients have stress and trauma because they're coming to us for help.
Right.
So even if you're not doing EMDR or whatever, like we're all going to experience VT. If we don't address it, then it can turn into compassion fatigue, which then can turn into secondary traumatic stress, which then can lead to burnout. And so it's more of like this continuum. It's not linear, but like when you look at it on paper, it can be presented in that way. And with burnout, I conceptualize that as like jumping ship. You are jumping into that lifeboat because you feel like you have no other way to survive. And that is not what I want for therapists. I want them to be able to make informed choices about their clinical work, their caseload, the kind of things that they're doing to make money and live their life and support their families. And not all of that has to be super intense trauma work at all.
Yes, exactly. Right. Yeah. And it's been a process of like permission giving, even for me, you know, like even when I was, you know, brick and mortar only. And then it was like, well, I really want to do telehealth so I can have more flexibility and work from anywhere. And, you know, and there were like the clients that didn't want to go with me, you know, so I had to make that decision. Okay, I'm going to have to let them go to take care of myself, you know, and then, you know, still heavy caseload, but then it's like, I really want to get into this coaching thing, but you know, it's requiring like 30 hours a week and I can't see 30 clients and, you know, so you have to like start to pare those down. For me, it was like take an honest look, like how many of these people am I actually seeing that maybe I could see every other week? Like if I really like look within or really don't need me anymore, you know, I could probably graduate them out. So, you know, it was a process of doing that. And then it was like, you know, I am exhausted after seeing like these 10 are just too heavy for me. And, you know, so making the decision to, you know, tell them this just isn't going to be my specialty anymore. I'm going to have to refer you to somebody that can do this more intense work and that sort of thing. And, you know, it was not easy to do that because all that stuff comes up. Like we should be perfect. We should be able to handle anything. We should be like a blank slate. Like everything just bounces right off us. But looking back on it now, obviously I'm super grateful that I was able to do that, you know, because I talk to clinicians all the time that are like, you know, I can't even travel because I don't want to like let another therapist handle my caseload for a couple of weeks if something comes up. Like they feel super responsible for this stuff. And, you know, I guess I'm saying all this to put that message out there too. Like you've got to check in with yourself and track, as you're saying, all these different areas. And then, you know, what is actually your passion, you know, and then how can you make your clinical work fit around that, or your coaching work or whatever you're doing if you have different income streams, you know?
Yeah, I totally agree. And I think too, kind of thinking about some of the like the larger like cultural, social stuff that we deal with as therapists, another way that VT will show up is in these kind of comparisons amongst us as therapists or amongst like treatment teams, right? Like, oh, well, I see the worst of the worst. I see like torture survivors, like, and what, you're not good enough because you see sexual abuse survivors, like, you know, and it becomes this armor that we put on because we believe understandably that it's going to protect us, but it ultimately gets so heavy and pushes people away and isolates us. And isolation is the greatest risk factor to hit the gas on that trajectory to burnout.
Oh my gosh, such a good point. And even as you said that, I'm also thinking about just this like Facebook world of online therapists. You know? I mean, talk about comparison trap. I mean, Facebook, sometimes I'm like, if I have to look at another thing on Facebook, I'm just going to die. But of course, I've created this like these two huge communities, you know, and I'm moderating these. It's it's like, what are you thinking? So you have to like recheck yourself all the time. It's like, this stuff's hard. And like, there's going to be difficult people, even in like Facebook groups that you have to like deal with. It's like another form of, I don't know if you call it vicarious trauma, but just like the comparison thing and how heavy that can even get, it's like so much coming at us all the time.
I know, I agree. And myself also running an online community, I think I take that role as like the admin and the moderator really seriously, because I think it's so important to protect those spaces and for the people in my community, the people in your community, to know that there is someone who is doing that, because there's not always someone who's really actively moderating and managing these spaces.
Yes, absolutely. And it's a heavy load, not to complain about, the success that we build or whatever, but there's a whole other level of stress that comes with that sort of stuff too. We talk
it's just another form of like caring so much about our work, and then also having to find new boundaries around like ourselves and our time, and also our beliefs about how do we know if we're good enough or not?
I know. It's like, who am I to jump in and like stop this thread when these people are arguing or whatever, you know what I mean? But like you said, you've got to try to keep your community safe and do the best you can, but it's stressful too, And then it comes back to what you said in the very beginning, having some sort of community where you can go and just like talk about all this stuff with other people that get it and are open and loving and supportive and all of that stuff, And it sounds like your Brave Collective is really an excellent resource for that type of support if you need it. Yeah. Who doesn't need it? I mean, I always talk in this podcast, I've got this core group of like other Facebook admins that, are therapists and build multiple income streams. And without them, like, I don't really know how I would even be surviving all this other stuff,
Yeah, it's so, and it's not about like us versus them necessarily, but we do really benefit from spaces where we don't have to explain ourselves. We don't have to do the whole backstory. Like we can just show up as we are in that moment, and we can trust that we're going to be surrounded by people who are going to understand, even if they don't know all the details. They're going to get the gist of it. They're going to know on a deeper level what you're needing and what you're trying to express. And that's so powerful.
Exactly. Yeah, exactly. Yeah. So we've been talking about it the whole time, your collective, but can we just like officially talk about it a little bit so people know what it is, especially to the traveling therapists out there, because this is something, people email me privately all the time and private message me. They're like, I love this, but I feel so lonely. Like, what do you do for support? How do you connect with others? So I think it would be great if you could just tell everybody about it.
Yeah, totally. So the Brave Trauma Therapist Collective is an online community membership. And I actually just recently took it off of Facebook. So the community is housed in Heartbeat instead of Facebook. And so there is certainly the online community aspect, and Heartbeat is an online platform, kind of like Mighty Networks. It's like the best thing I can kind of compare it to. But Heartbeat is where we have all of our content. So we work through that framework of name it, tame it, reframe it. We also have monthly guest experts. And so all of that stuff is recorded and it's accessible there in Heartbeat. That's also where like the online kind of asynchronous community lives, or we can chat and share resources, even share referrals, things like that. And then we have live calls, which really is where the magic happens, honestly. Like the online community is great and it's a wonderful resource, but being able to show up to our live calls is so energizing. So we have a content call at the beginning of the month where we talk about whatever the content is, wherever we're at in the framework, and to talk kind of how is that showing up in our work right now. And then we also have a consultation call on the third week, the third Friday of the month. And that is really just like an open-ended, just straight up consultation call. And in both of those spaces, but I feel like especially the consultation call lately, it just is so rich and supportive, and people, they show up as their whole selves for themselves and for each other. And we're just able to like be so honest and real with each other. And it's really, really incredible.
Oh my gosh. It sounds amazing. It really does.
Well, and
It's
when
like,
I was
ooh.
creating Brave, the dream was that it was going to be about the community, and the content would be, well, in Louisiana, we say lagniappe. So it's like a little something extra. I love this word. And it is like, the content is important, but it's about having a space where you can show up with people and just be real. And that is what we're really cultivating together inside the collective.
Yeah. And I mean, that's really what heals us all, right? Is that sense of community where we can be just totally authentic and accepted, you know, in a non-judgmental manner. You know, that's so healing. Yeah. Wow. Amazing. So how do people find you if they want to join or read more about it?
Yeah, so right now we're actually doing a lot. We're going to be opening enrollment at the beginning of March. So right after this goes live. So opening a new enrollment period. And so first things first, I would encourage folks to check out the workshop that I have coming up. It's on February 28th. It's at 7 p.m. Eastern, but there'll be a 7-day replay available, and there's a workbook. So even if people can't make it for any reason live, they still can access it. And it's the Vicarious Trauma Workshop. It's something that I've had available that people can purchase, and it was a recorded training. And I wanted to do it live to really be able to bring people together so that we can work on some of the content in the workshop together. Because there's like, we go through the tracker, we do some exercises, but there's also a lot of reflection involved. And so my goal with running the workshop live is that we can really experience what it's like to do that reflection collectively. And it's a free workshop. And so we'll have the link in the show notes, but it's it's braveproviders.com/VT workshop live, but we'll put that in the show notes.
Yes, definitely.
And so that's like the best way to quickly find out about Brave and to experience what it's like to kind of show up in a room with me, in a Zoom room with me, to see, you know, what it's like to be around other trauma therapists who are also committed to doing this kind of work.
I love that. Thank you so much. Thanks for taking the time today.
Yeah, it's my absolute pleasure. I love talking about this stuff. It's so funny. Whenever, like, especially on Facebook, like follow me Fridays and stuff, I always say like, follow me for all things like overcoming vicarious trauma. And then in parentheses, I always say like, it's way more fun than it sounds, because it actually, it's not that bad. It's like, I love talking about it because it is energizing. And I think it's really freeing to be able to have permission to talk about this stuff.
Yeah, I'm glad you said that, because I mean, even when you first like reached out to me and I saw the word vicarious trauma, it's almost this reaction like, oh, I don't even know if I want to touch that, you know, but you know, that seriously, that was my first like, and I was like, no, this is awesome, you know, of course, but I'm glad that you're like saying that, like, we can make it fun. It doesn't have to be this awful thing, and just really giving us permission to look at it, because, you know, of course, we're always like, oh, all these helping fields, EMTs and nurses and frontline workers, like, gosh, we got to take care of them and make sure they're handling their trauma. Okay. But it's like, we hardly ever talk about that with therapists, you know?
Exactly. Yeah. And we deserve to be cared for too.
Absolutely. Yeah. Thank you so much.
My pleasure, Kim. Thank you so much for having me here today. I really appreciate it.
You're welcome.
Thank you so much for listening to the Traveling Therapist podcast. For show notes, links, and downloads, head over to thetravelingtherapist.com, where you'll be able to learn more about my journey, the courses I've created for you, and other exciting resources to make your dreams become a reality. If you've enjoyed this episode, please share with your traveling therapist friends, subscribe to the podcast, and if you loved this episode, please leave a review.